Thank you. Well, every fall brings cooler weather and with it cold and flu season. SSM Health VP of Ambulatory Care Services, Dr. David Ottenbaker, joins us to talk about surviving the annual cold and flu season. And he has advice on when and where you can get care when you're not feeling your best. Thank you so much. Important stuff to talk about today. So many respiratory viruses, they're hard to tell apart. So let's talk about some of the symptoms for each of these different viruses.
Well, you know, many of the viruses, and especially now since COVID has come and become known about 3 years ago, a lot of those symptoms are very similar. Right now, we do have a little bit of a mini COVID outbreak. We haven't seen influenza yet. So if you really want to know if you have a fever, some upper respiratory symptoms, you want to know if you have COVID or not, you can certainly do a home COVID test, and we would certainly recommend that.
That's what I was going to ask. Are we still doing the COVID test? I know not as much at the doctor's office that they're recommending them.
Correct. I mean, if you have a higher risk, if you're elderly or if you have some other chronic illnesses, then you probably should make a decision to be seen for your symptoms. But if you do not and you want to know, we would certainly recommend a home COVID test.
Okay, so what are your recommendations for at-home care if you have any virus?
I mean, the typical, take your Tylenol, take your ibuprofen, rest, lots of fluids. Probably the most important thing is stay home until you recover, and we do recommend at least 5 days if you have COVID before you get back into the workforce and those sorts of things.
Is that similar for, say, if you have the flu, 5 days? Is that a good general recommendation?
5 to 7 days is what we say.
And I think that's a good thing that we've learned throughout the pandemic is it's just better to kind of stay home. I know a lot of people tend to still come to work feeling like they need to keep working, but stay home when you're sick. When's it time to see a doctor?
Well, again, as I said, if you have a high risk condition or if you're elderly and you want to be seen, certainly we would recommend that. We do recommend, however, we have telehealth services, and most of these cases certainly can be seen that way. And during our peak season last year, we probably had 3-4 minute waits in our telehealth services. If you were going, and you certainly can, go to an urgent care or your primary care office, sometimes those waits could be much longer. So a lot of these can be seen by telehealth services.
And how do we start using those telehealth services?
Yeah, I mean, we have it on our, from SSM, we have it on our webpage. You can go there, it's very self-explanatory how you can create that, and it's pretty easy, actually. And patient satisfaction is very high. They love it. They love the convenience. And again, most of these conditions, you don't need to be seen in person.
Right, and I've had some success with reaching out to my son's doctor just through the messages on my chart and getting a response and kind of getting some guidance on next steps to take. So that's another good option?
It is, yeah.
Okay.
Absolutely.
Okay, and then any tips on preventing illnesses? We know the basics, washing hands. What else do you recommend?
Well, it's the same thing, right? When you are sick, stay home.
Yeah.
When you are around a congested area, and maybe we have a mini outbreak again this winter, people have to make a decision. Do they put a mask on, right? I mean, do you do that in high indoor congested areas? Washing your hands, good hand hygiene, those are the basic things that we've recommended throughout this whole pandemic.
And so you mentioned that we've seen COVID this year, a little bit of a spike. Anything else that we're seeing right now?
Right now, COVID and just the run-of-the-mill upper respiratory infections. Influenza hasn't come yet. You know, RSV will probably be in the mix at some point. Trying to predict that, they're probably suggesting that it'll probably be fairly similar to what we experienced last year. But again, we'll have to wait and see.
Okay. Well, thank you for your insight tonight.
Thank you.